For Practice Update, I'm Dr. Farzana Hafizullah. Today joining me, I have Dr. Minesh Mehta, Professor of Radiation Oncology at the University of Maryland. Dr. Mehta, thank you for joining us today.
It's a pleasure.
We're going to talk about the Novo TTF 100A device. Can you give me a little bit more detail about the device itself? Any kind of restrictions for these patients, or patients who are not allowed to use the device, the length of time that they have to use it, etc.?
So this is a novel technology. Conventionally, treatment for cancer is based on the principles of using surgery, radiation, and chemotherapy. With this device, alternating electric fields are actually applied, and the biological principle behind this is to produce mitotic arrest and preclude the tumor from growing further, and then inducing apoptotic cell death as a consequence of this. As a consequence, it's required that the device be placed on the target, in this case the skull, on a continuous basis. So patients have to wear the electrodes on their scalp for the majority of the day. And of course, there's an electric current that's necessary for this, so a battery pack is something that a patient carries on their back. It's like the size of a small backpack.
Are those electrodes changed daily?
So the electrodes have to be changed every few days, and that requires that the scalp has to be shaved. The scalp has to be kept clean, and because of the constant application of the electrodes on the surface of the scalp, there can be a skin reaction that sometimes requires a little management.
Wow, that's phenomenal. So this is at what, medium wave frequency?
Oh, significantly lower than that.
Okay.
So this is significantly lower than the typical electrical currents that we're used to, and significantly lower than most electrical devices would use.
Yes.
And as a consequence, it's very safe in the context of using it in almost all settings. Now, as a precautionary measure, people have tried not using the device in the presence of other electrically implanted devices within the body. But that's more precautionary than an absolute contraindication.
I see. Excellent. Well, the device itself, in the very beginning, it was used for recurrent glioblastoma. And then
Yes.
I believe it was the Data Safety Monitoring Board stopped the trial early because they saw benefit in newly diagnosed glioblastoma. Do you think now, just sort of moving forward a little bit, this might be a preventive tool?
That's an excellent question. And you're absolutely correct. The initial data were in the recurrent disease setting, but it's really the newly diagnosed data that are making people sit up and take attention and notice this device.
Sure.
You asked the question of whether this could now prevent micrometastatic disease from emerging into macrometastatic disease.
Yes.
So there is a clinical trial that's targeted to be initiated next year. Patients with brain metastasis will be treated with stereotactic radiosurgery. These patients have up to a 70% risk of developing new metastasis in the brain because there is already microscopic disease in the brain. So they will then get to use the device to see if we can lower this rate of overt expression of microscopic to macroscopic conversion.
Well, that's fantastic, and what a great advance that would be. Especially, the brain itself is a bit of a sanctuary in a sense, and radiographic imaging that we do have today, a lot of those micrometastatic lesions will escape notice.
Correct.
Many times. We really appreciate you coming out today to share some of the practice update with us. Thank you for joining us for Practice Update. I'm Dr. Farzana Hafizullah with Dr. Minesh Mehta. Thank you.
Pleasure. Thank you.